if your gut health and your stress and your sleep are not in check. So I want to make sure that you guys all understand that this is of utmost importance. The second thing I want you to understand is that all of these things that we talk about, immune boosting, especially with regards to this new novel virus, there's zero data, long-term data on things that can actually help in this virus. Now, there are a few things such as you may have heard, I think you've heard, vitamin C has been touted pretty highly in the treatment of COVID-19. So remember, there's a difference between treatment and prevention. So there's not much data. I mean, there's no data on COVID-19 anyways, but there's a few new studies that show that vitamin C in high doses can shorten the duration of a viral illness such as COVID-19. We still don't have enough data to make this a wide recommendation for all people who have the virus. Now, we also know that vitamin D supplementation, if you are deficient in vitamin D, can be quite beneficial in the setting of viral illnesses. And so you really want to make sure that you check your vitamin D level and do adequate supplementation. For example, I take vitamin D, and a lot of South Asians have low vitamin D, and I encourage you to check it and replace it with vitamin D3. The levels would be between 1,000 IUs and 5,000 IUs, depending on your particular lab value. The zinc dosage that has been looked at, that's a question from DTG's, 75 milligrams a day of zinc. And that, if you're thinking about it in the present scenario with COVID, you're probably talking about using it in shortening the duration of symptoms. Also remember that long-term zinc use is not recommended. There is a study that shows that zinc use during a flu season, supplementing with 75 milligrams can reduce your chances of catching that cold by 33%. But that's one study, and I think we've heard a lot of use of zinc in this current situation, and someone is asking, why is iron deficiency so common in South Asian women? Yes, there's definitely more iron deficiency anemia in the South Asian population, but it's very, very common in women in general. And so I think it's something that should be corrected, and definitely can help with the overall immune system. I can't see the questions in the Q&A. I'm trying to open this. Hold on. If you can put it in the chat box, that's awesome. And because I can't, for some reason, I know that there seems like there's questions, but I can't look at them. Open and answered. So if you have questions, okay, so you said, let me see this. So the question is, Sarah says, so you just walk about in the sun before the supplements. Can you just walk about in the sun before the supplements? Are you talking about vitamin D per se, or are you talking about circadian syncing? Oh, Sandy says, how to get enough sleep as a med student or resident? That is a great question. It's very, very difficult. I know with the new rules for medical students, for residents, I mean, it is much more likely for you to get sleep. Some of the things you can do is take a power nap between the hours of 1 and 3 p.m. That has been shown to be pretty close to replacing 1 hour of sleep. And that's a big recommendation that I teach people, is how to use that post-call time or use that time to get enough sleep. Sleep hygiene is immensely important when you're trying to work on boosting your immune system. Oh, Sarah says both. Okay, so yes, Sarah, for for circadian syncing, so improving your gut health and immune health, you want to ideally, in the ideal world, and I know not everyone can do this, is get 20 minutes of sunlight before 10 a.m. So that might be just a few minutes outdoors, and then the rest of it can be indoors. And we know that there's clocks in every single one of our cells, and that we can improve our gut health, our immune function, our brain health by having sun exposure or light exposure. It doesn't have to be direct sunlight in the daytime. We are not meant to be indoors with a blue light setting at all hours of the day. And so I think one of the easiest things you can do to improve your gut health, which is immune health and energy, is to go outside as a busy, resident, student, as a busy mom, person, whoever you are. Just make that a priority. Just go outside for maybe 2 minutes and maybe get some sun exposure through a window in the morning. If ideal 20 minutes, sometimes I only get 5, it's fine. Just get some sunlight. And then KP says, are there some recipes for your green juice and turmeric soup? I can definitely post them. I am over at Instagram at FastingMD. I'm happy to share that with you. It's ginger. So as you know, that there's a few things in the Indian, South Asian diet that can be helpful for immune system. Ginger is one of them. Garlic is one of them, and turmeric or haldi is the third. Garlic is, well studied, can decrease the incidence of the common cold by 30%. There was a large study that looked at 12 weeks of supplementation. And Shika says the recipes would be great. He said, is there a dosage of zinc? 75 milligrams looked at in the literature, Shika. So that, and remember, you don't want to actually be taking a lot of these things, for many, many months and years. This is not something that is supposed to be a long-term treatment. This should be very, very targeted therapy for the time being. And again, zinc is better results with shortening the duration of an illness rather than preventing it.